All right, we will go ahead and get started. Thank you to those of you who are joining. Um, Unfortunately, I can't see you, so that is too bad. But I hope that we can still be interactive and that you feel free to ask questions as we go through the presentation today, or there will be a time at the end for questions as well. And you can just put those in the chat. So my name is Elise Spronk, and I'm an occupational therapist at Kinetic Edge Physical Therapy. I have been here almost 19 years and have been working in pediatrics ever since I started working at Kinetic Edge, and have been really passionate and excited about our work with reflex integration and how that has changed how we practice as occupational therapists throughout our company, and what it's been helping families and children with, as well as adults. So excited to share this information with you. It's certainly not everything about reflex integration, but we'll give you a nice introduction to that. And yeah, so just a little bit about Kinetic Edge too. We have clinics throughout central Iowa. We have occupational therapists in our Ames, Des Moines, Newton, Pella, and Oskaloosa clinics. And we have all been trained in reflex integration, and it is a part of our work that we do with families. So anyway, we will just get into our slides here. So there we go. All right, so what are primitive reflexes? So reflexes are an action or a movement of the body that happens automatically as a response to a stimulus. So it's something that we do without even thinking about it. And primitive reflexes are automatic motor movement patterns that develop in utero and are fully present at birth to ensure survival of the newborn. So all of the reflexes serve a purpose in the newborn, and some of them also serve a purpose during delivery. And so as the infant grows and develops throughout their infant years into their toddler years, these reflexes assist in development. And so they typically then will get inhibited or integrated within the first year of life as the infant has developed their own movement patterns and no longer need the reflex to assist in that movement motor pattern. So most of these disappear or integrate within the first 3 to 12 months of life. However, there are some lifelong reflexes, such as blinking, that remain permanent and are necessary for us. These reflexes are usually observed or evaluated within the first 24 hours of the infant's life in order to assess their neurological functioning. And so if there is an abnormality with those reflexes, that may indicate something impaired neurologically. In typical development, those reflexes are inhibited or integrated within the first year of life. However, as we'll see as we go through the presentation, it isn't that uncommon that sometimes those reflexes continue to remain and can sometimes cause some dysfunction or difficulties for the child and adult. So why might these primitive reflexes be retained? This is probably one of the most common questions I get when working with families. I think parents oftentimes wonder, was it something that I did as the parent that, caused this to happen, or what might be the reason? And there's lots of different reasons, as you can see on your screen. Sometimes it's maybe a difficult birth or a birth via C-section. There can be trauma that occurs. Sometimes it's even just a congenital disorder. So the child is moving differently because of a disorder that they have. There can be stress involved in retained reflexes. Sometimes there are just circumstances that compromise the central nervous system or the sensory system or the motor system that cause those reflexes to be retained. I think that the most important thing to realize is that identification of the retained reflex and then working toward integrating that reflex is what is most important. So a lot can be gained functionally through the identification of the retained reflex and then knowing what to do with it. So yes, we always want to, try and figure out why did this happen, but sometimes we don't always know that. Sometimes maybe the child even just did things differently in development and didn't have that normal progression. So maybe they didn't roll very much as an infant, or maybe they, skipped belly crawling and went straight toward, hands and knees crawling, or they were an early walker. None of those things, we wouldn't consider those things bad, but, it just impacts the further integration of the reflex. And so why is integration so important? And, as you see there, it's all about function. We really look toward those retained reflexes that are causing some sort of impairment. There is no perfect person. If we, tested every person, all of us would have some reflexes that are retained. That's, not that uncommon. And so we want to make sure that the retained reflex is related to the child's function somehow. So, there can be times where perhaps we notice that there's a reflex that's retained, but it's not necessarily impacting that child functionally. Maybe they've learned compensatory strategies, ways to, make up for that, different ways to do things. And if it's not necessarily something that's going to then in turn improve, long term, that might not be one that we focus our time on. Whereas, there may be other reflexes that we can draw the connection to a lot of dysfunction for the child. And by working on it, we would definitely be able to improve their abilities to complete tasks. So we are going to go through some different examples of different reflexes and some of the things that we may see if those reflexes are retained. And so the first one that we're going to talk about is the asymmetrical tonic neck reflex, or the ATNR. So you can see a picture of this baby. It's that cute little fencing pose, positioning. So basically when the child's head is turned, that activates the reflex. And so when they turn their head to the side, the infant will extend that arm that's facing, that they are facing, and they'll bend the arm and leg on the opposite or the skull side. And so this reflex is important with a lot of different things for the infant. It helps them figure out how to roll. It assists in discovering their hand, so being able to bring their hand to their mouth. It helps with the development of sound localization. It helps with visual processing, midline crossing. So this reflex typically gets integrated between 6 and 8 months of age. However, if it does not get integrated, this reflex then may impact a wide variety of different skills. So balance can be impacted, difficulty crossing the midline. So in older children, we'll see perhaps letter reversals. We might see difficulty with right-left discrimination, just because the child never develops a true sense of midline. And so that can also impact a lot of different eye-hand coordination skills, such as, hitting a baseball, other racket sports, perhaps some swimming skills, riding bikes, all of those things that require that true sense of midline. There may be auditory processing difficulties. As I said, it helps develop sound localization. And so there may be difficulties noted with some auditory processing. There may be difficulty with reading because of the visual tracking and ocular motor pursuits that are impacted with a retained ATNR. Handwriting can be affected, as well as other visual perception difficulties. And then, as I said, the impaired bilateral coordination because of the midline difficulties. Another reflex is, in case you're wondering, we are going to get to some activities and strategies to help with some of these reflexes too. So coming up. Another one is the Babkin reflex. So this one is elicited by putting pressure into the palm of an infant's hand. And so this reaction, when we do that, we'll see the infant flex their head forward and their mouth will open and their eyes will close. Helps prepare them for feeding in those early stages. And so this reflex should be integrated in the first 4 months of life. But if it's not, this reflex then will cause some difficulties, especially with oral motor skills. And so, the first reason why a child even develops or discovers their hands is to bring them to the mouth. And so oftentimes with the Babkin, we'll see a lot of extra oral activity. So maybe they're chewing on things. They might be chewing on the inside of their lip or on their shirts, on their fingers, those types of things. They may be doing different things with their tongue, like, folding their tongue. You might see nail biting. Speech difficulties can be related to the Babkin reflex, including stuttering. And then even later in life, we'll maybe see some correlation with a retained Babkin and OCD and addictions, increased body tension. So, sometimes even like TMJ in adults, smoking or teeth grinding, and then anorexia. So again, it's an important reflex to pay attention to for a wide variety of reasons. The Moro reflex is also known as the startle reflex. And so this can be observed in an infant when they are in a reclined position and their head or neck is supported. And so when we release that support from the neck, it will cause their arms and legs to flail open. And so this is, a typical response until it gets integrated between the ages of 3 and 6 months of age. So the Moro reflex acts as a child's panic button. And so this reflex, when it is retained, can definitely impact a child's behavior and may sometimes get confused or also look like some sensory processing issues. So especially like the dislike of change or surprise, increased anxiety levels, mood swings. We may see an over responsiveness to different things going on around them in their environment, or even with vestibular problems. So they may be more prone to motion sickness. Sometimes we'll see difficulties with sleep with the Moro reflex. And so again, they are just overly responsive. Like the name indicates, the startle reflex, these kids, adults, might just startle a bit more easily. And so with this one, it's important to identify if the Moro reflex is involved in a lot of those kiddos who are having behavioral issues, because this would be one way to assist in improving that. The abdominal reflex is one that sometimes we will call it the sleep reflex. And so this one provides the foundation for sleep. And so if it's retained, it will definitely impact sleep, as well as other things going on during the day, such as attention, the auditory processing, cross-lateral movements, visual processing. So an important one to identify especially when we have families come in with sleep concerns. All right, so there's a variety of different schools of training for reflex integration. There's the Institute for Neurophysiological Psychology, or the INPP, and that method has been primarily used for identifying and assessing signs of neuromotor immaturity in children and adults. And then it does provide a drug-free, non-invasive method for intervention for retained reflexes. The other one that we use primarily in our clinics is the Moscatova Neurosensory Motor Integration Method, or MNRI. And this was developed by Dr. Moscatova, and it looks at, it isolates different primitive reflex dysfunction and then engages in restorative techniques, either manually with parents, therapists putting hands on the child to assist in improving that, or through active movements and exercises that are taught to the child and to the family. So we are not going to necessarily talk about those specific reflex exercises because those I take kind of one-on-one care, but I do want to give just some activity ideas that are easily able to be done at home. And so for the ATNR, again, that's the one where they look like they're in that cute little fencing position as the child is shown here on the slide. So what we want to do is bring things back to midline. And so one activity, and sometimes kids will do this with their sibling, one child's on their hands and knees and the other child is riding on their back like a little pony. And so you are having the child move from side to side, who's on their hands and knees, and the other one is trying to stay on their back. Again, it's going to work on also some core strengthening, but it's going to help bring them to midline. Sucking on a sucker or sucking through a straw can be a fun activity, especially on hands and knees, because they will keep their head in midline, and then their hands and knees, arms are extended. And so that works on integrating that reflex crawling while holding a beanbag under the chin. So, holding something down like this, again, keeps the head in midline while the arms are doing that reciprocal motion. And then any midline crossing activities, especially if trying to keep that head in midline. Babkin activities for integration. So crawling on hands and knees to just get pressure in that Babkin spot in the middle of the palm. So slowly opening palms in the mouth. So they might have their hands closed and then they're opening and closing. And then, it's maybe a fun activity, put a little piece of popcorn or a little, treat inside their mouth to close the gate. So open the gate, close the gate. Squeezing toys, a rubber ball in the palm of the hand, again, just to give that sensory input into the palm. Sometimes we'll have kids crawl, like maybe holding a small object in their hand to just give a little bit more input while they're crawling. Bursting the bubble, so an adult covers the child's hand and adds resistance while the child tries to pop their fingers through the adult's hands. And then, just even like Play-Doh activities, play, any type of activity where you're getting resistance and stimulating the palm of the hand. Moro integration activities. So the child can position themselves on their back and do curl themselves into a ball and then into a star. So just getting that repetitive movement of ball, star. This one, in infancy, a lot of times we'll play with our babies where, maybe they're sitting on our lap and we let them go back and then we pull them up and let them go back. And so they're getting that head extension and flexion. And so that's, really what we're trying to replicate in play with older kids. So maybe they're again laying on their back and they're hugging like a large exercise ball or stuffed animal, or maybe they're on the underside of a bolster swing, and holding on to that. Sometimes, if your child isn't too startled by this activity, they can lay on their back, and then you're dropping a ball and they have to quickly catch it with their arms, and legs wrapped around the ball. So like a big exercise ball, or ball sit-ups. So they are, holding that ball and then sitting up, and then extending. So so again, these are a little bit repetitive from what we talked about, with the different reflex integration implications. But, if we are able to successfully integrate the reflexes, then we'll see, oftentimes some functional improvements with that. So ATNR, being able to differentiate right and left side of the body, as well as developing limb dominance. So, sometimes we'll have those younger kids, especially, and maybe even growing into, older kids. Older kids usually love to think like, oh, I'm ambidextrous, I can use both sides, but that's not necessarily typical. And we really would prefer to see, a hand and foot dominance. And so integrating the ATNR will help with that. It will help with improved development of perception, both auditory and visual perception, improved or academic performance, and then development of higher executive brain functions. So, and I, hadn't mentioned that, the reflexes are the foundation upon which all of our other developmental tasks develop. And so, when we think about a bottom up approach to helping a child be their best and do their best, working on the reflex integration and the sensory processing side of things, are often our first line of defense, when we're working on some of those other higher level cognitive functions. The Babkin reflex, so integration can help again with their speech, so enunciation of words, stuttering, can help with move, like if you have a child who does a lot of movement of their mouth, especially during fine motor activities. We've probably seen those kids who are cutting with the scissors and their mouth is wide open, or they're licking their lips a lot. The Babkin is one that can work on that. It will also then, help with decreasing how much they maybe are chewing on their pencil or their shirt or their fingernails, just because they will no longer need that extra oral input. The Moro reflex, this one is probably one of the biggest for behavior regulation. And so looking at that sense of self-control, impulse control, stress management, organization skills, integrated thought, and movement patterns, improve creativity, improve self-esteem. So lots of big implications for that Moro reflex integration. And so how do we achieve this successful primitive reflex integration? So, it's really important to find a good fit, with your child's symptoms and with how intense the therapy should be. So, like I had said before, when we're testing reflexes, we also look to make sure that there's a correlation between what are the things that the parents and family are noticing at home. Is there a correlation between this reflex being present and the functional ramification of that? And so that's going to help determine how intense the home program is going to be and how intense the therapy needs to be. And then following through with the home program is really, really important. So if we think about how these reflexes naturally integrate in those infancy months into the toddler years, it's through lots and lots and lots of repetition. So, working on these reflexes in 1 or 2 sessions a week is going to help, but it's really, what is happening at home that's going to cause the best success. And so that's an extremely important part of the program. And so it's important that everybody is on the same page, that you know the parents or the guardians of this child are correctly educated on the reflex exercises that are being prescribed in order to ensure that that compliance is happening, and that the best results we can get will occur. All right, so this is just for a free screen opportunity. And so if you are curious about more, your child's reflexes, or like I said, we do also work with adults who may be having some functional concerns about their reflexes. We do free screens, no obligation for those. They're 20 minutes. And if you're from a little ways away, sometimes we'll even do those over the phone, just to give you a better idea of whether or not it'd be something that would be worth pursuing. So I'll leave this up here, but I would love, we went through that really quickly. So I'd love to, to have some questions. If you have any of those, I'd love to answer those. And just, yeah, see what I can help with. All right, I'm also going to put up my email address there. So that is my email address. So hopefully we can, you still feel like if you have questions, we can ask those here. But if it's something you'd rather email me about, I'm happy to answer that for you too. So like I had said in the beginning, this is just a few of the reflexes that we assess during our evaluation time. So in addition to these, we also commonly look at several hand reflexes. So hand grasping, hand supporting, hand pulling, several foot reflexes such as the Babinski and foot tendon guard. We look at fear paralysis reflex, which is another one that has a lot to do with behavior. And then we look at some spinal reflexes, the spinal galant and spinal parez. Those oftentimes will also impact, especially incontinence issues, so bedwetting. That's one. Those two are ones that we'll look at for that. And then also can have some impact with the sensory processing and fidgety behaviors. So kids who move a lot, we will look for spinal galant, and also sometimes with picky eaters. So picky eating is a common thing that we work with. Lots of times kids who have other sensory issues may also struggle with picky eating. And so we will look at Babkin, the spinal reflexes primarily, but then also even the foot reflexes, if that has to do with some oral sensitivity. So, and then we also look at STNR and TLR. So STNR, TLR, and ATNR are the ones who reflexes that have a lot to do with like visual issues, visual concerns. And so academic concerns can frequently be tied to those reflexes as well. And so those are some of our more common ones, but also we will look at leg cross flexion extension, trunk extension. There's several different ones that we evaluate and then look at to determine whether or not it's an important one for us to work on. So. I think also, it's important to identify or to talk somewhat about the implication of trauma with reflex integration. So oftentimes we will see those who've been subjected to trauma still have reflexes that are retained. And so it's an important piece when we are working with our clients who have had trauma. The reflexes, when they are retained, are housed in the brainstem and back part of our brain, which is also where trauma is often housed. And so working on those while looking at, from a trauma informed lens is important. Also, with the presence of reflexes, it essentially puts us into a higher state of fight, flight, fright. And so when we are functioning out of a state of fight, flight, fright, our behavior is definitely going to be impacted. And so through working on some of these reflexes, we can generally bring a sense of calming. So there are even some manual techniques. The bonding reflex is an important one for those kids who have difficulty with bonding. And so that's one that we teach caregivers, um, trusted adults to help with at home, to help release those endorphins and bring them to a calmer state of mind. So yeah, any questions? All right, I'm going to stay on here for a few more minutes. So, if you want to stay on and ask a question, that is awesome. Otherwise, I am grateful for the opportunity to talk with you today. Like I said, I wish that we were in person and that I could see your faces. But this will have to do for now. And if you have any questions after the presentation, feel free to email me. One of my passions is helping others who are perhaps parents or caregivers of kids who are struggling, or even adults who might be struggling with some of these um, things that could be caused from this foundation not being quite as stable or as strong as what it could be. So I'm happy to help and grateful for that opportunity. Thanks for joining.